Hey, you guys. Welcome to another episode of Sugar-Free Self-Care TV. On today's episode, I'm so excited to bring on a physical therapist to change things up a bit. And this physical therapist actually has such an interesting perspective on pain that I wanted to bring to this show. And here's why. When it comes to managing our cravings for sugar and not eating certain foods that we love and always had before, like things like bread and pasta and flour, it can feel very uncomfortable. And something that I've noticed among myself and my clients recently is that when we are faced with discomfort, our perception of that discomfort can either worsen or lessen depending on how we perceive the discomfort. So, what I talk about with Sue today, which I invite you to watch, is how actually our perception of pain can be worse or less depending on your perspective of it. And this is actually related to what I teach with sugar cravings. And so, we have a fascinating conversation on that. So I can't wait to present to you my interview with physical therapist Sue May from Sydney, Australia. So let's give her a warm welcome on Sugar-Free Self-Care TV. All right, hello everybody. So welcome to another episode of Sugar-Free Self-Care TV. I'm so excited to present to you guys my special guest for the day. This is Sue May. So Sue is a fellow basically entrepreneur in the making. She's on the but basically we met through a community group together in a mentorship program that we're in, and I wanted to bring her on because of something she told me in a conversation we had recently. But before I dive into that, tell me a bit more about yourself, Sume. Like, tell me what you do and where you're from.
Hi everyone, I'm so excited to be here. Thanks for having me, Charmaine. I am based in Sydney, Australia, and I work as a physical therapist. I specialize, not really specialize, but my area of expertise is more in the musculoskeletal injury area. So I see people, for example, with ankle sprains, your typical hamstring strains or sporting injuries, fractures, all sorts of stuff. So yeah, pretty broad area, but fun.
Yeah, lots of fun. Like that's like, and that's a part of our lives that we just have to learn how to manage, right? Like, eventually at some point in our life, we're gonna feel pain of some sort, most likely, right? Like I sprained my ankle like a few years ago, and so I had to learn how to rehab that. But pain is kind of part of our life, and so it's so awesome that you work with people in that part where it's kind of very challenging and you help them recover from that, So what I wanted to talk about today, which I think is so awesome with your work and which fascinated me when we spoke in our last conversation, was just that, how do we basically perceive pain? And, it's interesting to bring this up in my show because I know when I coach clients, most people eat because they want to stop feeling a certain feeling. Like they don't want to feel a negative feeling, whether it could be pain, it could be boredom, it could be anxiety, but we try to numb those feelings. So what I was curious about is how you, in your practice, to me, like how do you help people basically manage pain as they, first of all, when they get this injury of some sort, like what kind of, tell us again, like for example, a kind of injury you see very often and how you help people with pain, like during that process. Like what do you exactly help them to do?
So ultimately, my role and how I see my role as a physical therapist is helping people return to the meaningful activities in their life, because everyone has some sort of meaningful activity. Like, for you, it might be lifting weights or running. For me, it might be, again, same lifting weights, but for some other people who are, more elderly, their meaningful activity could be, gardening or going for a walk with their friends or, picking up their grandchild, things like that. So whenever I see someone with an injury, the first thing I always want to find out from them is like, what is your purpose of being here? And then like, finding out like, what are you wanting to get out of this? What is this injury holding you back from doing?
Mm.
And then tying that, because that kind of almost drives their motivation as well, of like why they want to be, not necessarily pain free. Sometimes it's unrealistic to tell people that they can be pain free, especially those people who've been living with pain for a while. So let me just share a definition here of what pain is. So pain is defined as an unpleasant sensory and emotional experience associated with actual or potential tissue damage. So there
Mm.
is this perception that you only get pain if there's tissue damage.
Right.
And I think that is logical. I don't blame people for thinking that, because whenever we get a cut or bruise, like, we always get some sort of pain, right? Like, so people will link, okay, pain to damage. Though there are cases where people do experience pain without actual tissue damage, meaning that they do get physical pain when they don't actually have any tissue damage in their body. So we don't actually have pain receptors in our bodies. It's just more, we have these receptors that pick up signals from an injury. For example, like if we have tissue damage, it sends chemicals to our brain, and then it is in our brain where all this processing happens of whether or not we're experiencing pain. So there's almost like this threshold in our brain, and it's only when we perceive it as dangerous enough that pain is produced as a result.
Mm. Okay, that's so
So
fascinating. Uh-huh.
yeah. So then when we talk about pain, like, you can see now that it's more like, it says it's a sensory and it's also an emotional experience. So depending on whatever else, like, you like, so things like your previous experiences with pain, your beliefs around pain, um, your social support around pain, the people, like, people around you, are they supportive of your condition, or are they, judging you? Um, Anxiety, stress, all the other stuff that's going on in your life can also exacerbate pain, or reduce pain. So it can increase the level of sensitivity of your body and how that interprets pain,
Mm.
based on all these different factors. Yeah. So when we work with people who have pain, the people who generally tend to do better through the rehab process are people who have almost this, like, resilience to them. They are able to um, they're able to see, the positive side of things. They perhaps are not as they don't have as many negative beliefs around pain. They kind of still have pain, but kind of still carry on with their life as tolerated. Because obviously, when you have tissue damage initially, like, the pain is going to be related to that tissue damage. So, for example, you sprain your ankle, I can't expect you to run on day 2, because it's physically, you need your body to still kind of do the tissue healing,
Yeah.
right?
Yeah, it's very hard to run
Um,
from that point.
Yeah, but then for example, let me give you an example. If you had an ankle sprain versus I had an ankle sprain, we could, like, exactly the same way. Like, we sprained it exactly the same way. We went over this rock when you were running. We sprained it the same way, and we injured the same ligament. Let's say everything else is constant.
Yeah.
You could react differently compared to me, depending, again, maybe on our upbringing as a child. How did our parents react when we got injuries? Like, were they like, oh, like, it's okay, like, you'll be okay? Or were they like, oh my god, like, don't put weight on that leg, like, you're gonna hurt yourself even more? Like, so all these different things, like, and experiences can then influence how you interpret the world around you and how that pain is perceived by you. So you might feel it at a higher intensity than me because of that belief. Um, and you might have more fear and anxiety around that pain because of that experience in the past. Like, maybe perhaps your parents overreacted when you hurt yourself.
Right. Right. That's
Yeah.
fascinating though, because when you've seen that in patients, like when they have the same injury, and then like how would you notice that affecting the results? Like if one person has the same exact injury as another patient, like how did you see the difference like in their outcomes with that?
Um, I think a lot of the time it's like asking the right questions of like, you know, like what do you understand about your injury? Like finding out from the client like what their thoughts are. Really helps. And also sometimes you can see from the way they behave, like, you know, actions speak louder than words. Sometimes you can see that this person is very fearful of doing a specific task when you're assessing them. And so there are certain indicators where, you know, where like you can kind of somewhat predict, you know, there are tools to predict whether someone will be more likely to develop chronic pain, meaning
Oh,
persisting
wow.
pain that lasts more than, you know, like 6 months versus someone else. Like, so they actually do have like questionnaires and screening tools that people can use for like, especially lower back pain, because it's such a big, like everyone, like so many people we know experience lower back pain. So they've done a lot of research in it, and they actually have tools to screen whether, oh, is this person likely to develop, are they at higher risk of developing chronic pain because of, you know, certain beliefs or like certain things that they think about.
Oh, can
um
I ask you about that for a sec? That's really interesting. So how do you define chronic pain, and is that like does that mean it won't go away, or how do you define that?
yeah, chronic pain is often defined as like pain that persists for, you know, up to like, you know, months past like maybe the 6 month mark, or even years. Like sometimes people live with it for years
Mm-hmm.
because like there's a, I'm not exactly sure of the mechanism, but there is something about, you know, maybe the way the person reacts towards pain and their beliefs and their not wanting to engage in life and activities that kind of rewires the brain, rewires the central nervous system, that then makes their whole pain system a lot more sensitized than it has to be.
Oh, wow.
Yeah. So then at that point, most of the time it's no longer then related to tissue damage, because your tissues will heal, you know, pretty, it doesn't take super long. Like for most tissues, it takes maybe, you know, three months, 6 to 8 weeks type thing. And once it persists past that point, it's like, yeah, then your whole nervous system just becomes so sensitized because you're so used to feeding that loop that eventually, you know how that phrase where they say like you become the story that you tell yourself, it's almost like your body then starts to believe like, oh, like I am in pain, I can no longer do this, and then that becomes part of your identity. I think that is that's what happens, you know, in chronic pain. And obviously, there's going to be other factors, maybe genetic factors and things like that, that predispose someone to higher risk of getting chronic pain. But there's so many other things like your beliefs about yourself and like all this stuff that feeds into, you know, people developing chronic pain. And I also want to say this is something I'm quite like passionate about as well. The fact that when some people go to see like surgeons or doctors and things like that, like they're very well intentioned, the surgeons and the doctors, I'm sure they don't do this on purpose, but you know, they end up sometimes telling clients like, oh, you know, your shoulder is torn and your ligaments like hanging off the bone, so I'd recommend for you to not like carry any more than 1 kilo. And so this person leaves, you know, the consult feeling broken, feeling like, oh my God, like my body is breaking down. I can't use this arm and stuff like that. And so that's so disempowering. It's such a disempowering like story or narrative to give the client, because they feel like really helpless. And
Mhm.
then that, you know, that can spiral down into like, people often also have depression, and we know that depression exacerbates your pain, like especially people who've been living with chronic pain. Because once you get into this pain cycle, right, of like, imagine you have pain all the time, and
Right.
it's like the only thing that like that is in the forefront of your head. You're like, oh, I can't, you know, I can't clean the house today because when I hold the vacuum it's like really painful. um and that becomes their life. And when you can't engage in your meaningful activities in life, that's when people spiral down, because then they stop going out to see their friends because they can't walk for any more than 5 minutes, for example. And then they become socially isolated, and people and the thing is, like, they probably constantly feel like they have to prove that they have pain, because it's something that you can't see as well. So it's
Right.
almost like torture to them, because you can't, like, if someone fractured their foot, you can physically see that they're holding crutches and that they're walking weirdly, and that, all that stuff. But someone living with chronic pain, they could look like me or you, but you can't physically see that that person's in pain, if
Right.
that makes sense. Yeah.
Yeah, yeah, totally. I mean, it was kind of like me working in psychiatry as a psychiatric nurse, and it's similar with the stigma around psychiatric patients. Like if they have depression or bipolar, like you can't see it on the outside, but they have this diagnosis with them, and so there's kind of that kind of
Yeah.
identity they also have with that diagnosis, and trying to feel like they have to, like people don't believe them that they do have a psychiatric issue. So it's a really, that's interesting. There's like a bit of a parallel there. Yeah.
100%. And like, the funny thing is that we have something called, like, workers' compensation, or like, CTP, which is like, when you get into an accident, you get the insurance to cover your treatments and stuff like that.
Right.
And like, they've done research in those type of people, and the interesting thing is that, like, they don't do as well with their rehab, or because sometimes, like, in order for us to apply for more sessions for someone, we have to put in paperwork to prove that they're still in pain. And so
Oh.
they're constantly having to prove that, I'm still in pain, I still can't do my job, I still can't do this. And it's interesting, because it could be that story that they have to consistently tell, their GPs, their physios and stuff, whenever they go for follow-ups, in order to get more physio sessions, might be the reason why they keep getting stuck in the system,
Mm-hmm.
because they constantly feel like they have to prove themselves, that they have to prove that they have pain. And it's like,
Wow.
yeah, like, it's crazy.
Yeah. Wow. And that's an interesting cycle, because I feel like it's a really similar thing when it comes to weight loss and how I teach my clients too, because it's kind of like, if you have this discomfort similar to pain, like if you're feeling really uncomfortable, and if you don't want to, like, kind of face that pain, if you don't want to allow yourself to think differently about the pain, then how you feel like eating a certain way, if you're changing your diet and you eat a certain way, like how you feel is not, like, you're not going to be as successful, because you're kind of going to keep coming back to your old habits, because you keep wanting to avoid the discomfort of like moving forward. And so it's interesting. Like, I wanted to hear more about what you said with, when you have a patient who's in pain, like, how do you help them manage that? Like, do you besides like rehabbing them physically, like, do you offer a way to help people who might be, like, say, more prone to having the chronic pain, or in terms of like emotionally, or you guys don't really go into that, or?
um I mean, like, again, like, with those kind of things, like, in the initial assessment, I try my best to listen to the patient's story. I try to figure out, like, okay, like, how are you sleeping, how's your social support, like, I try to ask all these different areas as well.
Mhm.
And if I do feel like there's something going on in their life, like, like, they're struggling with their wife at home, like, or the family situation is difficult, or something's going on, and that can often take a few sessions as well. Sometimes people don't open up to you straight away,
Right.
because it takes time to build that relationship, build the rapport, and eventually, like, like, people then start to open up and tell you, like, really deep stuff about their life. And like, I think my job is to create a safe space for people, to make them feel like they can express themselves and things like that. And when I do find out that if there's anything emotional that might be affecting their rehab progress, because as we know, mental health issues can exacerbate pain. So
Mhm.
if they do struggle with something like that, then I'll either refer them and speak to them about potentially seeing a psychologist, or if it's like getting the appropriate help for them, or if it's not like horrible, if it's not too bad, like sometimes I just recommend for people to do some mindfulness practice. So I want to share with you this situation that happened to me a couple of weeks ago. One of my patients, he came into the clinic and he seemed really distressed when he came in. I couldn't really get too much of a proper like subjective, meaning like a proper interview with him initially, because he couldn't sit still. Like the pain was quite intense to the point where like he was just constantly sitting and fidgeting and stuff like that. So I couldn't really chat to him properly. And I was like, okay, I'm gonna just do a quick assessment and then like get him on the bed and do a bit of a massage, because he seemed like he was very stressed out, like very kind of like in that fight or flight mode.
Right.
And so while I was kind of doing that massage, I started talking to him a little bit more, and he started calming down a little bit more. And as we were talking, he's starting to tell me his story, and like we realized that he's actually got so much going on in his plate. Like he's just so stressed out and he's so anxious. He's got, his own business. He's got 20 people under him. He's anxious that the people under him are not going to get the job done because, he can't trust them, all that stuff. Like, and then, he's got a wife and 2 kids, but he's living away from them most of the time because of his work. He's constantly traveling. So much on his plate, right?
Yeah.
And it was kind of clear to me that like, okay, like, and also based on what he told me, that there wasn't any clear mechanism of injury. So there was no like physical trauma or anything that might have just caused this problem. So I was thinking, okay, it could be something else. And so like, after the first session, I just recommended to him like, okay, cool, like can I recommend you this mindfulness app, and can you try maybe doing some breathing and stuff like. And that's all I gave him. I didn't give him any exercise. I didn't give him any other advice apart from that, because he told me that he was struggling. Like, I mean, not struggling, I mean, he told me that he already does go to the gym and he takes care of his eating and stuff like that. So I wasn't too worried on that aspect of stuff. So then like the second and third time as he came in, he was like, oh, I've been doing these breathing exercises. It's been working for me like a gem. And I was like, oh, wow. Like that was the first time I've ever just like recommended mindfulness as the only thing that I've given to a client. I've never, like, I usually give them like a stretch or an exercise or something, but I thought like this is something maybe this guy needs. And by the third and fourth session, he then said to me, I didn't realize how stressed and anxious I was until I came to see you, and until we talked it out. And then he told me that like he was having suicidal thoughts and stuff like that. And I was like, whoa, like, like I would have never thought someone, like, because you can't see it. Like I can't tell that he was, depressed or anything.
Right.
And then, so now he's like, yeah, like I've decided that I need to get help. I want to go see a psychologist. And I'm like, oh, that's great. Like, like, let me know if I can help and refer you to the appropriate, pathways. So I think like the power is in actually listening to the person, because I think the person actually know themselves the best. Like I see my clients as the professional, and I let them kind of tell me their story, and I figure out like, okay, what tools do I have in my toolbox to help them? And so for example, for the people who are fearful of moving, if they come in, they have like negative beliefs around movement because of their previous experiences. It does take time, again, to slow, it's called graded exposure to movement. It's kind of like, I guess, like CBT. Like they use it in a lot of different, but we use it in the physical therapy context as well, where like you kind of like gradually show people that they can actually move. For example, if someone's scared of bending forward, I might get them to do it lying on their back first and try a different variation of the movement, and then use that to kind of build up their confidence, use that to kind of help them see that, hey, you can trust your body again. Like, look, like you're able to lift 1 kilo, and then maybe like over the next few months, you're able to lift 5 kilos. And then like, like just progressing according to the pace that the client is going at. And some people will take longer than others, but just kind of consistently practicing and showing them that, hey, your body is actually more resilient than you think it is. Over time, they learn to trust their body again. And I think that this rewiring process that happens in their brain, where like they consistently repeat the movement, and over time that desensitizes the nervous system. And then that kind of gradually, reduces their sensitivity to pain.
Oh, wow. That's so awesome. I never even heard of all of like I don't actually know so many physical therapists like on a like personal level, but I think that's really cool that you do. Like I love that you listen to them, you meet them where they're at, and you kind of just like you give them that support every step of the way so they build that confidence and that resilience to overcome the pain. Because what I was curious about is like I just think it's so fascinating hear you talk and saying like how so much of the pain just comes from our perception of it and our experiences of it and what we've been taught about it. Like I think it's so fascinating that it really has such a profound effect that it could actually like either hinder your progress, or it could determine like you know if you're going to move forward with the rehab or not. So I'm just like, wow, that's so fascinating. Like just how important it is to pay attention to what we believe about our pain and what we could tolerate. Like it's really interesting.
Yeah, and also just like, tuning into your body, like noticing if, that's why mindfulness is so powerful, I think, because it just allows you to sit there and observe like how you're feeling, because it's not about, like you said, it's not about pushing that pain away. It's about being curious. Oh, like what is this thing that's in my body? Like, and then leaning into it. Like we often try and push painful emotional pain, physical pain, we often try and deny it and push it away. And the more we kind of, stuff it down, the more it almost kind of the next time it comes up, it like blows up. Like,
Right.
like it's like, I think like the general principle here is like whenever there's any sort of discomfort, like it's important to be curious and to lean into it rather than try to find strategies to distract yourself or push it aside.
Right. Oh
Yeah.
my God, I love that you said that. That's so true. Like it's like there's nothing wrong with the pain. Like there's nothing wrong with the discomfort. It's just that you want to be curious about it and you just want to like observe it, which is it's totally true. Like it's the same exact process that I walk through my clients with when they have cravings, because a lot of time you want to push the craving away. You don't want to feel like that kind of agitation or restlessness you get when you just like, I just want to eat the cookie, I just want to eat the cookie and whatnot. But it's all about being curious about it and letting it be there and feeling that in your body and not pushing it away. So that is
Yeah.
so awesome that you help them like with the mindfulness also to kind of, is that a regular part of your practice or only just if you really feel like they have to like really address the mental health aspect of it, or
I mean, like I use it more for certain people compared to others, depending on, again, like where they're at in their process and what they need to help them get through it. Um, yeah, like I do see that some like when people go into this state of denial and start comparing their current self to their previous selves, that doesn't generally help. So that's one of the things that people maybe they're not leaning into their current situation. It's like what you're resisting will persist. And
yeah.
I genuinely believe like what you resist persists. So it's like some people who have back pain now who didn't have back pain maybe like 5 years ago, they're kind of like still in that stage of acceptance. They haven't accepted that, okay, this is me now, but what can I do now to help me, at least get back to some sort of activity? Because oftentimes I think people get stuck in that cycle of like, oh, like 5 years ago or 10 years ago, I used to be a gymnast. I used to be able to do splits. I used to be able to do this, but now I have this back pain. I feel like I can't even lift the vacuum cleaner, and that just feels horrible.
Right.
Yes, I understand that feels horrible, but it's like being stuck in that hole of like comparing your current self to your previous self is not helpful.
Mm-mm.
It's like you're resisting what is, because this is your current situation now. You can't, like, you can't change it. It's the same as, like, for example, people who've gone through breakups. And this is what I've noticed for
Oh,
myself as well. When you go through a breakup, you know how you get so stuck into that storyline of like, oh, like, I thought I was gonna marry this guy, we were gonna have 2 kids, we're gonna have this, and you get so caught up onto that storyline, you like that, like, you're constantly just living in the past. It's like you can't move forward until you've accepted that, like, okay, like, that storyline is no longer exists, but I'm gonna write a new story now. Like, this is me now. What can I do moving forward? What actions can I take today that's going to move me in a value direction? Like, that, it doesn't mean that you can't find someone else and create a beautiful life for someone else. Like, that is an option, but it's like, it's only an option if you choose to let go of that old story and be prepared for this, the next chapter of your life, basically.
right. Right. That's so good. That's so powerful. Like being
Yeah,
willing to, that's hard for a lot of people though. Like accepting that the
100%.
reality is, you have this injury now, you have this pain now that wasn't there before. That is hard for a lot of people, but I think, having that willingness to basically, look back on what you did and accept that that was in the past, and also be willing to stay focused on what's happening now so you could move forward. Because it's true, it's like we don't, like, what happened in the past, like, that's not really necessarily relevant to what's happening like right now.
Yeah, totally. And like, mental health issues like this anxiety and depression often happens when people get too caught up. Like, depression happens when people get too caught up in their past of like, oh, I used to be this, I used to be, 50 kilos, now I'm 70. I used to be this, I used to be that. I used to be the popular kid and now I don't know anyone. Like, like comparing themselves and living in the past, that often causes depression. And then anxiety is more like, you know, like trying to predict what the future holds for you when you don't really know what the outcome is going to be. So it's like when we're constantly living in the past or the future, that kind of creates those emotions. But if we're just kind of mainly living in the present and focusing on what can we do today that's going to make my life better tomorrow type thing. Because like the present's where you have the power, right, to change anything. Like, the past has happened, you can't really change that, you can only learn lessons from that.
Right.
um, the present is where you make the difference for your future. So the present is actually the most powerful, time that you have, really.
Right. Right. That's so true. And that's, you're right.
Mm.
That's what makes mindfulness so powerful. Like, do you have a quick mindfulness tip that like anybody could do to just help them be more present in their day-to-day lives? Like, what do you recommend for mindfulness?
I mean, the quickest, easiest thing that anyone can do that's available to everyone is, especially on days where you're feeling overwhelmed, just taking some time off, going, like, if you're in an office, just go to the bathroom or something, find a quiet space
Mm-hmm.
and close your eyes and just focus on the breath. Like, just focus on your breath, no judgments whatsoever, just taking some time out to breathe and feel your body and just, observe, taking note of how it's feeling with no judgments. um, and just consistently practicing that, even if you just start with 1 minute a day. Over time you'll kind of start to tune into your own body and maybe even realize that you're more anxious than you thought you are, like my client, because that's when he realized it. It's when he was able to pause. Sometimes we're so busy in our lives, no time to pause, no time to tune in to, you know our bodies, that we don't realize how it's feeling.
Right. Right. And we have so much distractions. We have so many so many things stimulating our brain, like whether it's food or the internet or like other people. Like there's so much going on that it's really hard to really be focused. So that's such a great reminder though. It doesn't have to be fancy. It doesn't have to be like an hour or two, like when people meditate. It just takes like a few minutes or even 1 minute to just be literally just like be tuning in and focus only on your body. And
Yeah.
that's all it takes. I think that's awesome. I wanted to share, I don't know if it'll show up, but I even have this little book called the Little Book of Mindfulness.
Oh, yeah.
So it's so true. It's literally just like a few minutes a day of practices to help with that presence. Cause that is what I teach my clients. Cause if they're not present, that's what causes a lot of the pain. Cause they're stuck up in their head and they're not
Mm-hmm.
comfortable with like what's going on right now. So I think that's so powerful. So we are out of time, unfortunately, but this is so good. Like, this is so awesome. I just want to recap a little quick. Like, okay, so we know that, how you perceive your pain can make it worse, or it can make it less or worse, depending on your perception of it. Mindfulness and being present in the moment is what will determine your results, not what happened in the past. And I also want you to let us all know, like, where can we find out more about you? Do you have any social media that you'd like to share with us?
Yeah, so you guys can follow me on @suemay.physio, so SUEMAY.physio. I'm also on Facebook on the same handle, and hopefully in the next few months, I'm going to be launching my own thing. I don't really have too much details on it, but it's probably going to be somewhere along the lines of helping people build resilience and feeling, confident and comfortable in their bodies again. So yeah, keep
Oh,
your
so
eye out for that.
yeah, you got to keep us posted. When you have that up, I want you to be back here and talk about it. Okay? Because
Yeah.
that sounds like a great opportunity for so many people. But thank you so much, Sume. Oh my gosh, I had such a great conversation. It was a lot of fun. And I can't wait to see what you create in the next few weeks, months.
Thanks, Charmaine. Yeah, thanks, Charmaine, for having me. I'm really grateful to have met you in the community. Like, you keep in touch. And one more thing for your listeners, I just want to say, like, whenever you're feeling physical, emotional pain, take the time to lean into it. Face it, because the more we shove it down, it's still going to come back to you eventually, but maybe even tenfold. So, like, we want to consistently be leaning into it. Be curious about it. Don't just try and avoid it.
Right. Right. That's so good. I'm just like, oh my gosh, I picked like the perfect person to talk about. And we'll see you next time here on the show.
Yeah.
All right. Bye. Take care.
Bye.